This physiological data explain the importance of abdominal breathing exercise, which should be performed by 2-3 minutes by exaggerating normal movements to thus acquire awareness of its performance. The extensive abdominal development of some oriental meditation is not due to fat, but rather to the abdominal distension caused by the constant practice of this type of breathing, which is usually used to achieve an altered state of awareness due to the high level of CO2 in the bloodstream. Complete breathing. This is a type of breathing that combines thoracic breathing and abdominal breathing. It brings a great deal of oxygen to the system and thus facilitates the state of great muscle relaxation. Superficial nose breathing. This is a variation of thoracic breathing that is performed energically and without letting a lot of air into the lungs. The range should be 30 breaths and 50 seconds, inhaling and exhaling through the nose. This type of breathing, along with other practice, is used to generate interval heat and activate respiration. It is very useful to induce an increase in heart rate and to activate respiration in the handicapped prisoners of Karatherapy, who is able to activate vasoregulator mechanisms in a small amount of space before beginning to exercise. Superficial mouth breathing. This is another variation of thoracic breathing, but it's much more brusque than superficial nose breathing. The rhythm to be followed is 25 breaths in 15 seconds, but it's very important to be careful when doing this exercise. Concentration of CO2 can reach brutal levels and lead to fainting. Inhalation and exhalation as through the mouth, and this practice combined with other exercise is used to generate internal heat. Panting. This occurs almost unnoticed in situations of stress or great physical tiredness, for example after making a great effort. Good practice of the stimulates the diaphragm and generates an internal heat that makes it possible to activate perspiration rapidly. It's practiced in periods of 20-25 seconds by breathing in and out very rapidly through the mouth. A single example will serve to illustrate how this is done correctly. The painting of a dog has very concrete connotation that are known by all on this is an excellent means of seeing how they practice this technique. All these methods are the preparatory work and are specific or Karatherapy are now specific to karate sport. The specific or karate lies in atemis and their repetition, as well as in techniques of blocking, personal defense and katas. Nevertheless, I would like to comment on the performance of an exercise that activates perspiration and heart rate than is Karatherapy, karate sports specific. It's also very well suited for working with handicapped persons. The exercise begins by taking 4 or 5 deep breaths, followed by holding the arms out at the sides and clapping by moving the arms forwards and backwards. This is followed by superficial nose breathing for 20 seconds, followed by 4 or 5 deep breaths, inhaling forcefully and raising the arms with the palms face up as in lifting a weight and exhaling while lowering the arms with the palms face down as if pushing an object toward oneself. Forward and backward claps are done with the arms extended and the cycle is repeated. 3 or 4 repetitions are usually enough to experience the desired effects. This has been a paper about disabled people. Now I'm going to talk about a study of HIV, people affected by HIV. Double-blind study evaluating the physical capacity of patients with HIV subjected to retroviral treatment after the realization of the kata and the medical application of cellular oxygenator and anti-fatigue treatment. Excerpt. The study's aim was to evaluate the response to physical exercise associated or not to medical treatment in a group of 40 patients of HIV, aged between 25-35 years, with antiretroviral triple therapy or an VO2 not less than 35 milliliters meter kilogram and not superior than 43 milliliters per meter. The common side effects for all the group consist of dizziness and headache. None of them did any physical exercise. The annual treatment was applied in 2 stages. The first of them with amino acid intramuscular injections together with biological formulas consisting of diluted muscle cells. The second stage consisted in applying interleukin-2 activators of lymphocytes and polyethylene glycol. Both stages were accompanied by a physical exercise program with katas. After 1 year, improvements were observed. The evolution was more significant in patients who combined exercise and or medication compared with those who were only given a placebo and didn't improve. With this study, we would like to present a physical medical technique of rehabilitation through the practice of katas, which could be very useful in reducing side effects of triple therapy. At the moment, we are working with interleukin-1, a treatment which has given encouraging results in its first trials. Material and methods. They are recruit 40 males affected of syndrome of HIV, aged between 25 and 35 years old, who take antiretroviral medication at least 3 years and which had no less than 35 VO2 milliliters meter or greater than 43 milliliters meter. Their CD4 range between 25 and 40 with leukocyte formulas and poor blood granulocytes among 51 and 60 figures. They are classified into 4 groups. The first takes placebo and does not do any exercise. A second group takes placebo and physical exercise. The third group takes medication but does not exercise. And the fourth group takes the medication and physical exercise. As for the methodology, you choose an exercise that we have selected for the benefits, low toxicity and ease of control. It's called kata and corresponds to a series of moves made to different rates and times, which were practiced in Okinawa and Japan, an exercise that have proven useful therapeutically. Only the second group, taking placebo and physical exercise, and the fourth, taking medication and physical exercise, performed the kata exercise during 2 sessions of 20 and 15 minutes with a frequency of 4 times a week. The medication used in the groups is based on a first stage which lasts 5 months and a formula for liver detoxifying and preparation of amino acids that is kept for 2 months, 2 weeks resting and returning back to take another 2 months. IHF1 hormone is introduced in the second month. A second phase of 6 months introduced interleukin-2 and polyethylene glycol are ready until the end of the work by keeping the above. The medication is supplied to patients in a comfortable way by a maximum of 5 formulations that are distributed in 2-to-1. Evaluation of results is done at an early stage by cycle ergometry 3 months after the start and another phase to the 9 from the beginning to be used for evaluating cycloergometry. Mechanical ergometer monarch with increased load every 3 minutes and increments of 60 watts. Basically, analytical studies are carried out at the beginning of the study to all participants, including the count of CD4 as matter factor of defenses, followed by another 3 months. In view of the results is finally chosen the initial group of the study. medicated patients with physical practice, and the group which only took medication but did not make physical exercise, preparing analytical studies with more than 200 parameters that include studies of immunity and muscle stress 4 months after and the year after the start of the experiment. The rest of the participants are checked out the total number of CD4 at 4 months at the end of the treatment. During this time were also carried out routine checks to all participants with a periodicity of 3 months by the countries where they came from. Results: 3 months after the initial treatment and cycle ergometry, each vein demonstrated significant improvement in the group who took medication and did exercise, reaching the totality of the subject values of VO2 between 45-53 mm metal kilogram, with a less than 30 cardiovascular recovery. Also increased the appetite, and there was an average increase of weight of 2 kilograms, with a decrease in liver transaminases in all of them. The group who were given placebo and made market exercise showed VO2 increase between 43-47 milliliters metro, with a cardiovascular recovery from 1 to 2 minutes. In this group, there was no decrease in liver transaminases. The group which only took medication and did not do exercise did not experience significant improvements in their physical performance, excepting that the recovery post-effort was better than before launching the program. There was in them an analytical descent in the counting of liver transaminases. The group which did not do exercise or took medication remained in the same initial settings. Non-specific symptoms such as dizziness and headache unchanged substantially in any group, but which performed exercise and took medication reported better tolerate. Second phase. In the group that carried out physical exercise and took medication was demonstrated 9 months after the beginning of the treatment, VO2 values between 55-60 mm metro with less than 30 seconds recovery. They also showed normality of hepatic transaminases, increased between 1-4 kilos of lean body mass, and decline in the intensity of the dizziness. In the group who only performed exercise and took placebo, VO2 values ranged from 50-55 millimeters with less than 45-second recovery and slight increase in transaminases. The intensity of the dizziness remained constant. The group which took only medication did not submit variations to VO2 with respect to the beginning of the experiment, while they decreased the number of transaminases and discrete improvements in dizziness. Conclusion: the practice of the movements of Karatherapy is sufficient alone to achieve good general condition of the patient affected by immunodeficiency, and will entail a practice of rehabilitation where effective to increase their quality of life. The muscular structure initially presents a contraction involving fatigue or fevers very quickly, and this is a proven aspect in muscle biopsies which we have been able to make in patients who have been subjected to the biopsies, perhaps because of the lack of myoglobin. This entails the destruction of fibers and a slower recovery than when adding the anemic pictures of some patients explain that muscle function is quite diminished, with the constant destruction of muscle mass that could influence the rise of liver transaminases. Therefore, it's recommended the practice of the movements of Karatherapy adapted to making biological formulation, which do not cause any harm to the patient and so beneficial that they may be according to the experiment. A program of sports rehabilitation in this patient is useful. It minimizes the side effects and avoids physical deterioration. Depression and other traumas and physiological obsession is associated in its situation. Our experience is very positive. Thanks to the organization and Illinois University accepting our investigation about rehabilitation by